Thank you very much for invitation me on the today meeting. I'm very sorry for my voice, but I have some problem with some infections after my journey to London. This was the very bad weather condition yesterday. I'm very sorry. In my presentation, I would like to present you the use of the enhanced combined test in the Polish population, as well as limitation encountered in the Polish population in terms of the use of the first biochemical test. In Poland, the use of basic biochemical test used in the screening diagnosis of the first trimester of pregnancy, in my opinion, is quite widely used. Sorry. The use of the use of the basic of the extended first trimester test was presented as early as 2011 by teams working under the leadership of Professor Nicolaides and Professor Spencer. As you can see, it was the much better detection ratio in the trisomy of 21st chromosomes, and for the trisomy, it was the same numbers into the PLGF and the same of the alpha fetoproteins. Of course, it was much better the false positive ratio. The same situation we can see, of course, in the papers from Professor Wrights from the 2014 reports, which shows improved detection ratio and reduced false positive ratio when PLGF and alpha fetoproteins and also ductus venosus pulsatility index analysis were included with fetal first trimester screening. The improved detection rates applied to both for the 21st trisomy and the 13 and 18 chromosome. It was the same situation. In Poland, we have some problem with this because still the PLGF not currently included in the package of services guaranteed by the National Health Fund. Now we are still in the contact with our Agency for Health Technology Assessment and Tariff System in order to introduce PLGF to package of services guaranteed by the National Health Fund. But we have the problem with this in this moment. The same conclusions to the advantages of the enhanced fetal first trimester screening was observed on the next papers, especially from the Canada, and the enhanced fetal first trimester screening increased detection of trisomies 18 and 13. On the following slides, I would like to present you with the result of the prenatal diagnostic program implemented with the funds of General Health Insurance in Poland. In this picture, we can see that in last year's 2020, we have decreased some patients, birth patients. It was from the 126,000 live birth to the 110 birth. It was, of course, this is not the birth, it's the number of the patients which perform in the prenatal research program. It was at about 31% of the population of the all pregnant women in Poland, and we can see the number of the patients in this group. On 2019, it was the 34%. In the 2020, it was 31%. the basic limitation of this program is the fact that it's dedicated mainly to patients over 35 years of age. Of course, other pregnant women with additional indications, such as abnormal ultrasound or biochemical test, or a positive medical history, have the possibility to access this test financed by the state insurer. The fact of the biochemical tests of the first trimester are standard in our country may be proved by the fact that at about 99.69% of all pregnant women who had an ultrasound examination on the first trimester of the pregnancy also had beta HCG and PAPE tests ordered and performed on this program. This is a very important situation. But we must note that unfortunately, not all the patients who have prenatal tests financed by the National Health Fund get this test in the first trimester of pregnancy. We can see that this biochemical test and the first ultrasound examination performed is carried out in the population by about 75% of the patient participation in the program. For several years, there have been trials of enhanced first trimester screening in the study population in several provinces in Poland. We can see that of whole Poland, these tests were performed in about 15% of patients diagnosed in the first trimester of pregnancy. The largest number of patients undergoing enhanced first trimester screening were diagnosed in Silesia and Wielkopolska provinces. In Silesia, it was at about almost 43% of whole patients. In Wielkopolska province, it was near the 20% of whole patients. Unfortunately, full utilization of the estimated first trimester screening in this population is currently impossible due to lack of the availability of the PLGF in the list of procedures financed by the National Health System. We have only the part of this enhanced fetal first trimester screen by only the alpha fetoprotein. Preliminary results obtained from centers that use this kind of the first trimester screening with alpha fetoproteins indicate a decrease in the false positive ratio and increase in the detection rate of trisomy first one chromosome. Unfortunately, a full picture of the implementation of prenatal tests in the Polish population is not possible due to the lack of data from the population of patients in whom commercial tests are performed. In our opinion, in this moment, the prenatal program screening payment by the private funds by the patient in this moment is at about 200 people in Poland, and it is, for example, it is at about 110,000 funded by the National Health System. For several years in the public space, as well as in some scientific reports, there have been questions about the advisability of screening based of first trimester screening. These questions, of course, have arisen mainly at the time of increasing availability of free fetal DNA tests. This topic has been widely presented by the Professor Piotr Sieroszewski. Of course, we must tell that in this moment, practically all over the world, the test using the screening of the first trimester of pregnancy for the aneuploidy is the ultrasound examination with the biochemical test. And in addition to their role in the prediction of chromosome abnormalities, we must not forget their enormous role in the predicting disorders characteristic of the second and third trimester of pregnancy, such as preeclampsia or of course fetal growth restriction. I think is the most important is this moment is the discussion about the role of the PAPA and the PLGF as markers used in the prediction of trisomy, preeclampsia, and small gestation age. And of course, it was very important voice of the Professor Nicolaides. However, taking into very important papers, it is the papers from the 2021, it is very important that countries where due to the lack of financing by the National Health Fund, the availability of PLGF is very limited. For example, in our country, and I saw that there's a very similar situation in the Romania and Bulgaria. And these papers from the 2021 reports that the very optimistic information for us that the PAPA is quite good to the screening for the first trimester. Of course, we are still fighting with our governments to introduce the PLGF to prenatal screening program. Thank you very much for your attention.